Timing of antiretroviral therapy after diagnosis of cryptococcal meningitis. Cryptococcal meningitis, a clone of a thyroid immunodeficiency syndrome related disease in Africa, is essential for survival. However, the question of when ART should be initiated after diagnosis of cryptococcal meningitis remains unanswered.
State health officials say what worries them most about this outbreak is the unknown. They don't know how wide it will spread and how those at risk will react. State public health officials announced Tuesday that 2 new cases of fungal meningitis tied to medications produced by the New England Compounding Center in Framingham, Massachusetts, have been discovered. That makes 6 local cases of the disease since officials say a problem was discovered with a type of steroid injection late last month.
We are working really hard with the national organizations and the facilities in New Hampshire to contain and identify this and treat those patients so we can make sure that people get the quality care that they deserve.
Dr. Jose Montero says they have also identified 2 other drugs that may be tied to this national outbreak that has already killed 15 people. Right now, he says there are a lot of unknowns.
It is concerning for all of them. How dangerous it is, nobody really knows because there is no specific way to know who will be developing the disease or who will not.
Applications in medicine. Methods. We assessed survivors at 26 weeks, human immunodeficiencies. Adults in Ghana and South Africa who had cryptococcal meningitis and have not previously received ART. Different are of 5 weeks after the diagnosis of cryptococcal meningitis was associated with significantly improved survival as compared with initiated ART at 1 to 2 weeks, especially among patients with a paucity of white cells in cerebral fluid.
New Hampshire Treatment Center Pain Care pulled all of its NECC-produced drugs immediately after being made aware of a potential problem and has contacted almost all of the 1,000 patients who are possibly affected.
We're not taking any chances on this one at all. If they show any signs or symptoms of meningitis or a local infection or a stroke, we bring them in and get them evaluated.
The McGrath Law Firm in Concord represents a 45-year-old New Hampshire man who they say contracted the disease through the tainted drug and filed a civil lawsuit against NECC in a Massachusetts court Monday.
He's going to have to file a regimen of treatment. It could be, it could be spinal taps. It could be, intravenous to the hospital. This is going to go on and on.
The state has set up a hotline to deal with questions about this outbreak. The number to call is 603-271-6617. Reporting live, I'm Andy Hirschberger, WMUR News 9.
Regulators have also said that New England Compounding Center violated its license in Massachusetts by not requiring a patient prescription.
Pros and cons. Cons. Patients initiated the trial after 7 of 11 days of antifungal treatment. Participants were randomly assigned to receive either are initiated within 48 hours after randomization or are initiated 4 weeks after randomization. We use it as computer-generated point block randomization algorithm with blocks of different sizes in a 1-to-1 ratio, significant on the presence of after high lower score indicate result level of disease.
Meningitis has resulted in the deaths of 2 people in Michigan, including 1 in Livingston County. The Michigan Department of Community Health says the tainted steroid shots are to blame. There are now 22 cases in Michigan. Another death was also just confirmed in the state of Tennessee. That's the fifth death there. There are 106 cases nationwide, including 9 deaths across 9 states, up to a month. So more people could get sick.
We do expect that this case count will rise, so we do expect to continue to provide updates, and so anyone that was at those facilities, we do highly recommend that they see a physician as soon as possible.
These shots were sent to 4 facilities in Michigan and Brighton, Grand Blanc, Traverse City, and Warren. Contact your doctor immediately if you received a steroid shot from one of those places. We've got more information on our website, Fox 47.
Diseases. Interim monitoring. The National Institute of Allergy and Infectious Diseases Data and Safety Monitoring Board for African Studies, reviewed interim analysis annually.